make your speech on Cumbria youth mental health crisis.
Thank you, Madam Chairman. What would you do if your child was seriously self-harming or trying to kill themselves and you couldn't get any help? After a year of trying to get help and getting nowhere, after a year of watching your child get worse, how would you feel? Would you be off work with stress? How would you cope if you were a teacher trying to educate large classes of children, but several were dealing with serious mental health issues? And most importantly, how would you feel if you were a teenager with a cacophony of negative thoughts hammering in your head and you asked for help and you didn't get any? The stories I'm being told on the doorstep are horrific. They are of children with diagnosed needs who don't get their annual reviews and become physically ill because they're on the wrong meds. They're of children being spat out of the system, not because they are well, but in ways that resemble people being inappropriately forced off benefits. On Tuesday, on a doorstep, I was told about a child who'd been waiting 9 years for an initial CAMHs assessment. I know my grave concerns about this crisis are shared by my colleagues from all parties, from the discussions we've had at local area planning meetings and on health scrutiny, and I would like to thank them very much for the encouragement they've given me to try and address this issue. I hugely welcome Councillor Burns' announcement today of the creation of a youth mental health network in West Cumbria. Through this, we will work to share information about and to strengthen the many initiatives that are currently in place, including those mentioned by Councillor Burns and also those set up by students themselves, such as the inspirational We Will initiative. As well as nurturing this network, I will also be working to ensure that the NHS co-production networks we've developed in response to our maternity crisis are used to address the NHS part of this youth mental health crisis, and I'll be watching that through on health scrutiny. But while we must deal with the effects of this epidemic, we must also challenge its causes. Councillor Little put his finger on it in a meeting. Education policy is very clearly directly affecting the mental health of our children. When new education policies are developed, they should be subject to public and expert scrutiny and consultation, which considers their impact on youth mental health. Now, of course, such a change in policy development would take time, but there is something that must happen with great urgency. At present, we have one minister, the Minister of State for Schools, who prides himself in not consulting with anyone on policy at all, and who covers his ears when people talk about evidence. He has personally imposed and is still imposing policies on schools that are clearly doing very substantial damage to the mental health of our children. Damien Hines, as Secretary of State for Education, must make it clear that such behaviour will not be tolerated in his department. Thank you all for taking the time to listen to me talk about an issue I care so passionately about. Please do all feel warmly invited to chat to me now after the meeting, or to contact me at any time if you would like to explore youth mental health issues, or if you have any questions or suggestions for me. Thank you.